World Trade Center disaster, that was an unprecedented event that many people died that day, but what it left was the huge exposure to the people who were left after this incident. Many people were exposed to the harmful dust that contained so much of chemicals, and now more than 20 years after, we are seeing there is an increased risk to develop various kind of cancers. So what we did is in this study, we collected the blood samples from the individuals that were exposed, specifically the firefighters, along with the help from Fire Department New York, and we sequenced the blood samples and then looked at the mutations that were in the blood of these individuals. We looked at the clonal hematopoiesis, which is actually a phenomena that happens as we all age. So it's an age-associated clonal hematopoiesis known as. When we age, we get this. 10% of individuals above the age of 60 to 70 have clonal hematopoiesis. So it seems like it happens as we age. But the individuals that have clonal hematopoiesis that develop various other malignancies, blood cancers, heart diseases, lung diseases, etc. But what was very interesting in this case was that individuals that were exposed to the World Trade Center dust, they have, first of all, elevated clonal hematopoiesis as compared to the control people. At the same age, they have like almost overall, if you see, more than 10% individuals had clonal hematopoiesis, whereas the control group had only 5 to 6%, right? Then the clonal hematopoiesis related malignancies we observed was also elevated. There was increased risk of leukemia, increased risk of all hematological cancer, increased inflammation in these individuals as well. Now, what was very interesting in this study we also observed was that the mutations, generally age-associated mutation has certain specific spectrum of mutation which we all observe in every individuals which has CH, but these individuals have a totally different spectrum of mutation, suggesting that it is not equivalent or similar to age-associated clonal hematopoiesis. It is something different which has been done because of the exposure, and it is more prominent. These set of mutations are more prominent in younger individuals which are not at the risk to develop clonal hematopoiesis, but in our cohort we do observe that in the younger individuals. And we are also looking at the mechanistic, that what is happening. We utilize murine models where we expose these mouse to the dust that was collected from the ground zero, and that increased the inflammation, genetic abnormalities in the mouse. So it's the causation is the dust with this study, and we have some preliminary observations as well when we delete a certain specific receptor for inflammation, IL-1RAP, which is an inflammatory sensor. In a murine model, when we delete this, it rescues the growth of this clonal hematopoiesis. So that also brings us a therapeutic target that can be explored in the future studies, whether treating patients or somebody who has clonal hematopoiesis, if we treat them with a IL-1RAP antibody or drug that target this, that could rescue the development of clonal hematopoiesis.